Good day. You are welcome to this channel. My name is Pastor Dr. Mode Victor. For those of you that are new to this channel, the purpose of this channel is to create awareness about health challenges and to share vital health information to save lives and also to minimize loss of lives as a result of complicated health issues. And I will also like to remind you to share, subscribe or click the like button for notification on update of new video. You can also reach out to me for more solution with the number on the screen. God bless you. Good morning, good afternoon, good evening. My name is Pastor Dr. Mode Victor. It's so consultancy from Gilead Phytotherapy Medical. I'm bringing on your way this day. I'm going to be talking about the causes of major health complication and sudden deaths. You will take a note. If you look at what is happening in our society today, you see that some of our women, they develop fibroid, some develop breast lump, some develop ectopic pregnancy, miscarriage, high blood pressure, diabetes, prostate problem. You see, some of these health complications that our people are undergoing. Some people look at it that it is a normal thing. They see it as a normal thing. But I'm telling you, they are not normal. It will surprise you to hear that some of these health complications are things that we can overcome. We can overcome them. It is because we are not taking the right step. And out of ignorance, that is why you see our people suffering from some of these health complications. You see, when we take the right step, we will live above them. You see, the reason is because many of our people felt they are okay. They don't have infection. I can begin to see that a lot of people are ignorant about what is called infection. We don't have knowledge about infection at all. Infection, by the way, what is infection? Infection is a disease caused by microorganisms that invade tissues in the body. When these tissues are invaded, you begin to experience different health complications that lead to sudden death. It's as a result of these tissues that are infected. That is why you develop liver problem, kidney problem, high blood pressure, ectopic pregnancy, and then you develop miscarriage, bleeding after delivering. All these health complications is as a result of these tissues that are invaded by this microorganism. You see, okay, let's take a look at a Plasmodium parasite. Plasmodium parasite is as a result of, when mosquito, bites you. The mosquito parasite, the mosquito, inject this Plasmodium parasite into the bloodstream. And when this parasite invade the bloodstream, it will affect the liver and cause jaundice. You begin to experience weakness of the body, drowsiness, weakness. It also affects the lungs. It can cause accumulation of fluids in the lungs. You must have seen some people going for lungs operation where they are absorbing those fluid from the lungs that have led to the death of so many people. It is caused by this Plasmodium parasite. It's also as a result of, it also causes high blood pressure, low blood pressure, anemia that have claimed the lives of so many people. But yet, our people will be telling you, I don't have infection. I want you to reconsider this statement. Don't you think we are living in ignorance? It's ignorant. You see, so just like the way this Plasmodium parasite invades the bloodstream, that is how we have other parasites, microorganisms. Like what I've earlier said in the past video, I said that this infection is in the air, in the land, in the water. I'm referring to microorganisms. They invaded the entire community of the human being. They're in everywhere. these microorganisms are there. From there you see whether Staphylococcus aureus, Candidiasis, E. coli, and all of them. Those ones that causes pelvic inflammatory disease, that causes damage of fallopian tube, uterus lining. All these are as a result of infection that invaded, the tissues in the human body. You see, but when you don't have awareness of some of these things, we begin to suffer so many health complications. There was this man, this pastor that came. I met this pastor. The wife went to labor room. This woman, after delivering, she bleeded about 2 occasions and gave up. But thank God they were able to revive this man. So when I went to see the husband, I called him. I said, Pastor, this thing is as a result of chronic infection. Pastor say, forget about it. Don't even say that. Don't you know me? How can you say my wife have infection? My wife never have any infection. So I said, okay, I left. After some time, this pastor fell sick. And he now called me. He said, Pastor Modi, are you in the office? I said, yes, I'm in the office. He now said, okay, I'm coming to do some checkup. I said, okay, I'm in the office, you can come. So when he came, I carried out the checkup for him. I sent him to the lab to go and do tests. When he came with the result, we saw Staphylococcus aureus. That was how I told this man. I said, see, what we are seeing now is something very small compared to what you are going to see in your wife's body. I said, if I check your wife, if you didn't see chronic infection, that means just take me like somebody who doesn't know what he's doing. This man went the next day and brought his wife. When the wife came, I carried out the same checkup. I quickly sent her to the lab. They did test and brought the result. Lo and behold, heavy growth of infection. Staphylococcus aureus, Candidiasis, E. coli. This pastor was surprised. He was shocked. He was asking me, he said, what is the cause of all this? What must have caused all these things? I said, yes. When I told you the other time, you said nothing of such nature. I asked this woman, have you not been experiencing anything like itching or anything before? And she said, no. I said, no, since your mother gave birth to you, have you never experienced anything like itching before? This woman said, yes, some time ago I experienced itching. Somebody now told me that I should use warm water, boil water, and put a salt on it and alum. I should sit down on it. And as I keep on doing it every time like that, that was how, the itching stopped. You see, some things that we are doing out of ignorance. This is what many of our women are doing. And as they are doing that, because they doesn't notice anything itching again, they now felt, oh, infection is gone. I don't have infection again. Before you know what is happening, they will now face chronic health complications that almost claim their life. You see, these are what people are doing. So, but when you have this awareness, when you take the right step, you will discover that we can live above some of all these health complications. We can live above them. You say you don't need to wait for sign. This is one of the major reasons why our people are dying mysteriously. They'll be asking you, what is the sign? If somebody have infection, what is the sign? Look, let me tell you, you don't need to look for sign. I have said it in my first video, the earlier time I said, we derive infection from maternal bloodstream. This is what I want everybody to know. We derive infection from maternal bloodstream. The vein that connects blood to the placenta, that filled the child with oxygen, and nutrients. We derive infection from maternal bloodstream. As you are growing, these microorganisms are developing every day. That's why if you go to the hospital and see our children, you are going to see a lot of health complications. You are going to see a lot of defects. Children that are born with a lot of defect as a result of this infection. So women will be telling you, the other time when I was pregnant, they treat me for infection. Ignorant. Can you treat infection when a woman is pregnant? You can't treat infection when a woman is pregnant. You see, those medicine or augmentin they are giving to you, just to help you so that you can deliver, that is not treatment. Some people will not even go and take medicine for 2 weeks and take drug and say, oh, I have treated infection. Is that not the reason why a lot of people are complaining that infection doesn't go? I have treated infection, it doesn't go away. Some will even tell you it's a spiritual thing. The reason why you are suffering is because you don't have real-awareness about infection. You don't have real-awareness about infection. You don't have real-awareness about infection. You see, when this infection invade tissues in your body and you refuse to treat yourself properly, I'm telling you, it will lead to sepsis. Sepsis is a situation where infection has gone to a higher level in your body, where the entire organ in the human body begin to respond to infection. And this can lead to sudden death. It can lead to sudden death. You see, it can lead to sudden death. There was this woman who came to my office here. You know, this woman have already gone for, they did an operation for her, cancer of the womb operation. So when she came, her womb has already been removed. But this time around, she now developed bladder problem, kidney problem. When I checked her, the kidney filter was damaged. That's proteinuria, and the bladder was also infected. And I asked this woman, I said, I hope you said you did operation the other time for cancer of the womb. He said, yes. I said, didn't they treat you properly? He said, oh, they did everything. They treat me well. In short, I was okay. I even went to church for Thanksgiving. I said, now, what is the cause of this bladder problem you're having now? This proteinuria you are having, the kidney filter that is damaged, what do you think has caused it? The same infection that you claim, you have treated. You see, so when infection is not properly treated, you begin to face different health complications that can lead to death. That is why our people are dying mysteriously. Some people will say, it is winch. It is winch. It's not winch, my brother, my sister. It's not winch. It's because you are ignorant of this microorganism that evade tissues in our body. But if you take the right step, you will see that you will live healthy, stronger. Even at old age, you become more livelier. You see, we are saying these things so that our people to create awareness. And some of you that are listening to me, I want you to share this video to save life. Share this video to save life. You see, share this video to save lives. We have to take the right step to treat infection in a proper way. When these infections are properly treated, you will discover that you will overcome some of these health complications that are claiming lives of people. There was this man that came here for checkup. When we carried out checkup for this man, I discovered this man have testosterone deficiency and chronic prostatitis. So, being that with what I've seen already, I know that this man cannot perform as a man. So I asked him, Oga, are you performing as a man? I said, because from what I'm seeing here now, you can't perform as a man. This thing has affected your organs seriously. Are you performing as a man? The man looked at me. He just paused. And he said, but I'm not giving birth to children again. I have finished giving birth to children. I'm no more giving birth to children again. So can you see what ignorance can do? If you're not giving birth to children again, does that mean that you should not be able to perform as a man? You see the reason why some people develop prostate cancer and died prematurely. These are the things we are talking about. You see, this is why people are dying prematurely. You see, he's having this issue. He's still saying, I'm not having children again. You see, erectile dysfunction, most of these things you are seeing, they are serious health complications that can lead to sudden death. Because erection have to do with good circulation of blood in the body. When there's excess cholesterol that have invaded, the arteries, or fat accumulation, or maybe the adrenal wall is weak, there will be no good circulation of blood. And these things can lead to heart attack, heart failure, stroke. That is why as a man, If you are not performing well as a man, I'm advising you quickly, come for checkup. Come for checkup. You know, some people they are going to tell us, hey, I have done checkup. They said I don't have they said I don't have infection. I have done checkup. I'm going to tell you, there was something that happened here in my office. A woman came here. After carrying out checkup for her, I told this woman, Madam, you have fibroid. You have chronic infection. This woman went home. He said, I'm coming tomorrow for treatment. She went home and never come back again. Only for me to see this woman after almost 6 months interval or so, or more. This woman came here. She was pleading with me. Hey, Oga, I'm sorry. Oga, I'm beg. Help me. I said, Madam, what is the issue? He says, life and death too. It's life and death too. Madam, what is the problem? He says, it's my neighbor. I would have come ever since for the treatment too. When I get home, I told my neighbor what you told me. My neighbor said, I forget that place. Come, let me carry you to a better place, a better hospital where they are going to check you very well and they are going to know what is going on. Immediately they treat you. Everything will be over. He went there. They did check up for her. They took her urine, took her blood, took her swab. They did scan also. They said there's nothing like infection. They did scan. They told her you don't have fibroid. You see, this woman said she was in the house one day. She said the next thing she saw was chronic pain. She started shouting, only I'm dying, only I'm dying, only I'm dying. When the man saw the situation of the wife, this man ran into the compound and called neighbors. Say, please come, my wife is dying, my wife is dying. Neighbor, they ran, they came and they said, they should go and bring keke. That was how they rushed this woman to the hospital. She said she was in the hospital when she opened her eyes and discovered that she was in the hospital. After, she was revived, the doctor now asked her to go to one clinic and did scan and brought the results. When they brought the result, the doctor now told her, say, Madam, the fibroid that you have is big and is bleeding seriously. That was how this woman started crying. That was how this woman came back to me, telling me to help her, that she's sorry. She's sorry, that she never knew it was her neighbor, that if I think she's telling lies, she can even carry me to the hospital, let me go and see things by myself. That if I get to the hospital, I'm going to see everywhere is glinting, or the machine, they have standard machine that they are using in diagnosing people. The woman was asking me, he said, Doctor, can scan tell lies? Is scan telling lies? I said, Madam, I don't know. It is you that went for checkup. It's you that can testify what you saw. I didn't went there with you. So you are the one that can tell what you saw. You see, I want to use this to advise every one of you. It's not every place you go and they say they do checkup for you. We have checked you. And then you not think that they have done proper checkup for you. You now go and see them. Before you know, you made sudden death. Before you know what is happened, you meet your predicament. I'm advising you, come for checkup. In this place, we have a standard machine that we are using to diagnose people. A standard machine for diagnosing people. With the help of this machine, we can be able to diagnose the entire organ in the human system. And we'll be able to know what is going on in the body. You see all this one, you see our women carrying fibroid here and there. Is because, why? We don't have good machines. With these machines we are using now, before a woman develop fibroid, let me assume a woman is going to develop fibroid for the next 3 years. Immediately we check this woman, we are going to see it in her hormone and we'll be able to correct it. And after correcting it with organic medicine, we give this woman an organic medicine that kills tumor cells in the body. By so doing, the fibroid can never develop back again. The same thing is applicable to breast lump. There was a lady that came here, that we have treated just about 4 or 5 months ago now. This lady said she has been going around everywhere in this worry for 2 years, different hospital. They will do checkup. They say they are not seeing anything wrong with the breast. They will do checkup. They say they are not seeing anything wrong with the breast, and this woman is dying. She's dying for pain. Pain every time. Until a lady that had placenta abortion, 2 occasions, this woman have placenta abortion. And the baby died in her womb. They operated her and removed this baby from her womb. It was God that saved her. You know, she went to this lady and told her, say, please, come to Dr. Mode. He's the one that treats me. Come to him. This thing that they are saying, they are not seeing anything, and you are dying every day, pain. Please, come to him, let him check you. If he will not see what is going wrong with your breast. This was how she brought this woman here. We checked this woman. The one they are saying they are doing scan ever since, they are not seeing anything in the breast. We saw chronic breast calcification. That was how we commenced treatment immediately. As I'm talking to you now, the strong menstrual pain that this woman is noticing is gone. Pain, crying every time, going to church, banding and casting, everything is gone. So you can see, this is issues that have claimed lives of so many people. But by the grace of God, we are taking care of them. We are taking care of them. I'm not just here, to entertain people. I'm telling you reality of life. Very soon time is coming. I'm going to upload some of those videos so that some of you can see by yourself. Some of these people, they are going to speak with their own mouth so that you will see what is happening to our people. So that you'll be able to know that it's ignorance that is leading to sudden death and some of these health complications that our people are facing. A lot of lives have gone. We have lost a lot of lives. Many people have died mysteriously, dying of liver and kidney issue. You see, let me tell you something. Liver or kidney doesn't just kill somebody overnight. Do you know that some of the children we gave birth to, some of them develop liver or kidney problem as a result of malformation of the structure in the fetus? When our women gave birth to some of these children, you see, before this liver will kill some of these children, they will still live up to something 35 to 40 years before some of them will die. So you can say that liver or kidney problem doesn't just kill somebody overnight. Because we don't have a good machine to diagnose, to know some areas when some issues are going on in the liver, when the liver is not producing enough bile, when the energy production of the liver, is going down, when the liver cannot metabolize carbohydrates in an effective manner. We can detect some of these things. And before you know what is going on, gradually, people begin to develop chronic health complications that lead to death. And at the end of the day, they will say the man died of liver and kidney problem. But here, we have the machine. We diagnose some of these things. And when we diagnose them, we have, a lot of organic medicine that can handle some of these health complications. My brother, my sister, you have watched this video. Don't just look at it like that. I want you to share this video to your brother, your sister, your friends, your relatives, even the church where you are going, even the mosque where you are going. I want you to share it to these people so that we can save lives. People don't need to just be dying unnecessarily like that. And people are there telling us it is witches and wizards that are causing it. It's not witches and wizards. Some of our people that you see that are dying mysteriously is as a result of wrong medical checkup. That is what is claiming the lives of our people. You don't just have to remain one way. That is what is claiming the lives of our people. And some people, they are going to tell you, don't use organic medicine, don't go for herbal medicine, herbal medicine can kill people, herbal medicine can do this and do that. So let me tell you something. Anybody that tell you such thing, ask them this question. Our forefathers that live 150 years, 120 years, who don't even know anything about orthodox medicine. At that time, there's no clinic, there's nothing where they are staying. How did they survive? If they die, will our generation come to stay? Then secondly, if you go to most of our university today in Nigeria, I even want you to browse it. Just browse it on Google by yourself and find out which of this university that are, training students, that are admitting students on how to produce herbal medicine. You will discover that majority of our university are admitting students. Is it University of Lagos? Is it University of Ibadan? Is it Enugu State University? They are admitting students to train them on how to produce herbal medicine. So don't allow anybody to deceive you. Herbal medicine is the medicine that our people, even right from creation, people have been using it. People have been using it. And it's effective. Most of the testimony we are having here, they are the handwork of organic medicine. And our organic medicine are medicine that are medically prepared, that are NAFDAC certified. These are the organic medicine we are using to treat people. We correct, as we treat, we correct weak muscle tissues, boost your immune system, revive dead cells and tissues in the body. And by the time we after treatment, you will get yourself. Let me tell you something that will surprise you. You can't come here for treatment without you bringing somebody, without you going to recommend somebody. You see that lady that have placenta abrasion. If I tell you a lot of people that lady has brought to us, a lot of people, because she was shocked that how is it that all these things that have been running here and there, spending money from one hospital to the other, here and there, the first time the baby died, the second time the same placenta abrasion, running up and down, and I went to somewhere and immediately come and see what has happened to me. She started, bringing people. Say, come and see, come and see, come and see, look at the place here, look at the place here. She become like the Samaritan woman in the Bible. So when we treat you, no matter the health complication you are undergoing, just come to us. Come to us. In case of you want to talk to me, please, I want you to give a call. Give a call and reach me, and I will discuss with you so that we can all tackle most of these health complications that are claiming lives of people. And by the grace of God, I'm assuring you, we are going to achieve the will of God concerning our life. The will of God for us is to live in good health, sound health, to see our children. It's not to die prematurely. It's not to live in sicknesses all the days of our life. The will of God is that we be in good health, even as our soul prospereth. That's what God promised our people. But when you see what is happening today, it's like the will of God is not fulfilled. The will of God is fulfilled. God has made a provision for every one of us. The reason why we are facing some of this health complication is because why? We are ignorant. Ignorant. Nonchalant attitude. I beg you, forget it. Is it today we have been hearing all this kind of thing? And you sit down there until, death visits you. I want to use the opportunity to thank every one of you that is watching. I appreciate your effort very much. And I want you to share this video. Share it so that we can save lives. And as you do so, God is going to bless you. God is going to bless you richly. Like what I've earlier said, my names are Pastor Dr. Mode Victor, a sole consultant to Gilead Phytothera Medica. You see, may God bless you very much. Thank you very much for watching this video. And by the grace of God, I'm expecting you. See you more time at my next video. God bless you. Thank you very much.